Good morning. I'm kind of a last-minute replacement for the speaker who had a family issue and couldn't make it here today. But to talk about the role of public health in the social determinants of health. And I want to go back a little bit to some of the things that Dr. Kearney talked about with some questions. I want to think for a second. You're walking into the physician's office and you have a fever 103, but let me ask you first, how old is your house? And what year did you buy it? Or what year was it built? And what's the temperature of the water heater in your house? I mean, those are some of the things we ask, right? But sometimes it's important, right? If I am a parent with going in for a pediatric visit and I ask you what the temperature of the water heater is in the house, all of a sudden now that's clinically relevant. That's something that's of importance for the pediatrician. So these social determinants, what I want to stress here is there are so many of them, they're community-wide, and it depends so much on the patient and what's going on in the situation. Sometimes they're clinically relevant, sometimes they're not. We have a lot of great screening tools for like alcohol use, depression, and stuff like that are really great tools for the clinician to use. But is a clinician the best person to be asking that, or some other provider in that group, the one who should be spending that time with those questions? So the big part that I'm trying to answer is, who are the groups that should be asking these questions? It's not always the physicians that's the best person to be asking them, or the best use of their time to be asking that question. And then how do we bring all these different partners together in the community in order to answer some of these social determinant questions? So I have a couple examples that I'd like to talk about from a public health perspective, just to kind of give you a general idea. So we have one place where they looked at snowfalls after a winter storm. And you can kind of look at the data and you start to see, a couple of days after the storm, you start to see falls in certain areas of the community. So how do you help prevent the falls before they become acute care? Right? Well, you can look at data based on where the falls occur and then track it to see who has shoveled their sidewalk. Right? The city of Boston has done this. They go out and they look and they see 2 days after they see an increase in falls, and they send groups out afterwards to say, you're supposed to have your sidewalk shoveled within 24 hours after a snowstorm. So they can not only predict where they need to go, but they can also start to prevent those falls. And is that a social determinant or not? That's kind of another question. Is whether someone shovels their driveway or not, or their sidewalk, an important indicator. But it does help prevent care in the future. Another good one that comes up a lot of times is after disaster. Like we just had this severe flooding in Florida and Texas. So when they do the after-action report, the one thing that comes out as a sleeper is the people who are seniors in social isolation of some kind that need oxygen at their home, and we didn't know where they were. Right? That's always that sleeper question. So how do we determine that group, and where is that data kept? And then the other part that I think, this is where I really get stuck thinking about this issue, is not only are these questions important and the different diversity of the data really important, the different partners you have to outreach in the community, but also, when does a physician know where to go to ask these types of questions, right? We have all these different places. Well, depending on where we're looking, we can go to 5 or 6 different community centers to try to find out this information. Is that really worth it? So how do we get this information in one place that a physician knows to go to? And I think you brought it up from Duke. Looking at that, you don't really want to go outside of your EHR, but you also sometimes need that information. And there's some examples of when they do this successfully. Immunization records is one. Newborn screening records controlled by public health is another good area. Poison control centers is another place where physicians just know this is where you go when you have these issues come up, and they know that. But that's part of an education and training and marketing that we're not quite there yet, but that's something that I think that needs to happen with some of these social determinant issues as we move forward. Environmental, we heard some environmental issues too come up looking at lead screening. There's so many other ones that come into effect when you're looking at that. Travel is another big one. Do you want to be asking about travel all the time? How about occupation? Trying to code the occupational codes. You look at that, and if you're not trained in that area, it's really difficult to code occupational codes. And when is it important to have that information, and when is it just not relevant? And then should that information be kept in the EHR? I mean, it costs money, and then, you know, there's different business practice associated with data in the EHR. Even if it's not HIPAA related or not, there's a different business practice associated with it. So you need to think about that and what that cost is, and is that really the place where it should be kept, and is it the most up to date? You heard someone else talk about up to date information. How do we know when it's been updated and if there is an update available? So these are all, I think, huge issues that need to be tackled as we approach this. And we talked about the different prioritizations that need to be in place. What are we going to tackle first and when and so forth. But I think getting that framework is going to be incredibly, just a big challenge in itself as we move forward. The other area that I think that might be related to this is also part of that personal health record space as well. We talked about exercise and the ability to exercise, right? But if you have a device like a Fitbit, you know, here's information. Now, your physician doesn't want to see your daily walking miles and where you went and that. But it'd be nice to know, they probably want to know if you did exercise every day or how many days a week, right? How to summarize that information. But then not for everybody. I mean, if you're in good shape and you come in with a good BMI, you know, that's less important than if you are overweight or have cardiovascular risk or diabetes or something like that. So those are some of the questions, again, of where to keep that, how to keep that, and then how to present the information in a way that's relevant at the time of the clinical encounter. And I think that's probably the biggest point. So the other part I want to bring in here is all the different community partners that might be related to this. Who has that responsibility for bringing them together? And we know public health has done this role for a long time. They do it in the community already. They bring together diverse groups. Parks and recreation for exercise and where you can go. Crime statistics. So we're just trying to think of the roles in the future, and I see the role of public health being really critical in moving the social determinants forward from the community setting and getting that type of information and where that should be placed. Now, how to get it in a way that's relevant for the clinician at the time of the encounter, I think, is the other challenge of that. And that's the leadership role that I think public health needs to respond to, and how to do this in a way that makes sense, and then where to store this information in a place that makes sense. Not all of it should be stored someplace in its aggregate or in its just, you know, individual discrete form, but it should be somewhere to let people know how to get to it, where it is, and what information is there. And then the last point is, when you start talking about this, we have a huge educational component. We have to train providers, we have to train public health, we have to train the community. We talked a lot about health literacy. I didn't want to get that, you know, imagine a physician asking you the health literacy questions. I just think that can get kind of funny after a while. But how do we do that in a way then to develop this health literacy around social determinants as we move forward? I don't have any answers for this. I just know there are bits and pieces that have been done by public health. We look at immunization records and so forth. And some of the information that's collected. We have people looking at exercise, and they know that's important. Immunization records, again. Certain other registries that are important. We do a lot with maternal and child health. We have a lot of risk factors associated in social determinants with smoking and so forth with child delivery. So this is information that public health has used for quite a while. It's just a matter now of where to get that information, how to put it all in one place, and let us move forward. I was very glad Margot Edmonds talked about see if I find it here. The stewards of change, right? So I think this is great news as far as I'm concerned, because this is part of the discussion that now needs to happen and move forward. And I think that response after that meeting and in the next couple of years is going to be really important. And I think this is something that we'll be able to address in much better detail at the next AMIA meeting. I'm really looking forward to how we move forward with that. Thank you for your time.